sound waves are actually the ones who are helping them for detection of the prayer or their navigation. 150 years after that, in 1924, I believe, by David Griffin and his team, they figured something that is called echolocation. So when giving the ultrasound waves of high frequency waves, we can, or actually bats can, see their prayer, they can even navigate, as I said. This is something that we use later on in discovering on an ultrasound machine. First time when it was used, the sound as finding submarines, it was a few years after Titanic sank, and that was in World War I for checking and seeing submarines. How was it introduced into medicine? I would like to go into obstetric doctors. This guy here, Jan Donald, although I thought McDonald's because it's a Scottish obstetrician, applied first ultrasound on pregnant women and left this around after 2 years after my father was born and my mom was probably just asleep. How we use it today. So when you enter my practice, and if you were 11 to 14 weeks pregnant, so your baby is basically 4 to 6, 7 centimeters long, I can check everything, basically, what has been developed so far by an ultrasound machine. I can tell you if there is any structural abnormality. I can tell you by checking the ultrasound markers like nasal bone, like fluid behind the baby's neck, like a small little vessel in the baby's liver, or even checking the baby's heart that is a grain of rice size. I can tell you if the baby probably has Down, Edwards, Down syndrome, or any other genetic, chromosomal, or cardiac abnormality. I can screen you to tell you that you are in a high chance of developing something called preeclampsia, or a growth restriction for your baby. 20 weeks, so the baby is roughly around 400 grams, and we can tell you a lot about it, and we can tell you that there is a 90% accuracy if you know how to scan any abnormality with the baby. That all is helped by a high-resolution ultrasound machine. At that point, we can already see the behavior of the baby. We can also see the gestures of the baby by using 3D and 4D scans. And by measuring small vessels in the baby's brain, we can tell you the baby has anemia and if it needs a transfusion, which are today ultrasound-guided interventions that